Hi, and welcome to Dr. Welling's Health Show. Today we will be discussing blocked fallopian tubes, also known as tubal occlusion. It is a condition where the fallopian tubes are partially or completely blocked, preventing the egg from traveling from the ovary to the uterus. This can make it difficult for a woman to become pregnant and can also increase the chances or risk of ectopic pregnancy. That means the pregnancy that occurs outside the uterus. Now, usually there are no symptoms of tubal blockage, and that is a problem for delayed diagnosis. Sometimes a woman can experience pain or discomfort in the pelvic area, pain during intercourse, pain or discomfort during ovulation, heavy or irregular periods, and obviously infertility or difficulty in conceiving naturally. Now, if you are facing difficulty conceiving naturally, you should call the number on the screen for our specially formulated homeopathic treatment for assisted reproduction therapy. To treat the root cause of infertility, here we will talk about tubal blockage and help you get pregnant naturally. Now, it is important to note that many women with blocked tubes may not experience any symptoms at all. In fact, blocked tubes are often discovered during routine infertility evaluation at our clinic and during a diagnostic test for other conditions. So, how do we diagnose the blocked tubes? It involves a pelvic examination by a specialist and imaging tests such as X-ray, ultrasound, or even something called as hysterosalpingography. It is a test in which a special dye is injected into the uterus and fallopian tubes, and a series of X-rays are taken to check if the dye is able to pass through the tubes. If the dye is not able to pass through the tubes, it is very much likely that they are blocked. So the usual treatment for block of tubes depend on the cause of the blockage and the severity of the condition. If the blockage is due to pelvic infection, antibiotics may be prescribed. Surgery to repair or remove the blocked tubes may also be suggested by a gynecologist. Now, in cases where the fallopian tubes are severely damaged or cannot be repaired at all, your gynecologist will suggest IVF that can be recommended as an alternative option to help you become pregnant. Now, as you know, IVF involves fertilizing an egg outside the body and then transferring the fertilized egg back into the uterus. Here it's important for women who are experiencing the symptoms of blocked tubes or are just diagnosed and who are having difficulty in getting pregnant to seek medical attention very urgently. With the proper diagnosis and treatment, that is surgical or our natural homeopathic treatment, women with blocked tubes are able to get pregnant and have a successful pregnancy. That's all in today's episode of Dr. Welling's Health Show. Bye and take care.